Hello, my name is Dr. Sayyid Junaid. I'm a consultant radiologist, and in this video we will be discussing DVTs, or deep vein thrombosis. A DVT, or deep vein thrombosis, is a clot that develops in the deep veins of the arms or legs. The legs are by far the most common location for this to happen. The clot itself can break off and then travel along the veins into the heart and then into the lungs. If it enters the lungs, it can cause something called a pulmonary embolism, which is a serious diagnosis and also a known cause of sudden death. In this diagram, we've got two veins. One on the left is a normal deep vein, and we can see blood flowing in nicely. The one on the right, a clot is formed, and therefore it stops the flow of blood and causes the leg to swell up. This clot can also then dislodge and then end up in the heart, and following that into the lungs, where it can cause a pulmonary embolism. The three common symptoms of a DVT are pain, swelling, and redness of the leg or arm. I mean, the legs are by far the most common cause of that, and so you don't have to have all three symptoms for you to have a DVT. There are certain risk factors of having a DVT, which we'll discuss now. Recent surgery, particularly orthopedic surgery, is at a high risk of developing DVTs, and that's why many patients who have had orthopedic surgery, for example, a repair of a fracture, or they've had a knee replacement or a hip replacement, will be put on blood thinning tablets for a period of time to reduce that risk. Also, being in hospitalized environment, often many patients will have had Clexane injections or heparin injections into the tummy. This is again to reduce the risk of developing DVT. Long haul flights, because your legs are stationary for a very long time, the blood sort of stagnates in the legs, and therefore there's a risk of developing a DVT in the legs as well. Fractures, particularly lower limb fractures, are at an increased risk of developing DVTs, and especially following a fracture repair, patients may be put on blood thinning medication to reduce that risk. If you have a family history of DVTs, specifically certain blood clotting disorders such as factor V Leiden, can increase the risk of developing DVT. Cancers increase the risk of developing a DVT, and in fact many patients, the first time they present to hospital is with a DVT, which then triggers a whole load of investigations, and that's when the cancer is discovered. In the pregnancy, the blood of the patient becomes more prothrombotic, i.e. more likely to clot, and therefore being pregnant is an increased risk of developing DVT. Prolonged immobility increases the risk of DVT, particularly when patients have had surgery and has led to them not being able to be mobile. So one of the best ways of diagnosing that is through an ultrasound. We can directly visualize the veins. We can look for any thrombus within the vein. We can do Doppler examination of the vein itself and press the vein. So often when you have the DVT scan, we will scan from the groin all the way down to the ankle, and we'll be pressing on the veins as we go along as well, and looking at the Doppler signal within the actual vein to make sure there's nothing inside the vein. Thank you very much. I hope you found this video useful. If you have any further questions, please email us or visit our website acornultrasound.co.uk.